Thank you for that kind introduction, Jean, and thank you to Mariella and the organisers, to Angle and Jean, for the invitation to speak here today. So I know this has been translated, so I'm going to try and stick to my script that I've given the translators to make it easier for them. But I'm going to talk to you about our experience in Ireland of building partnerships with patients and what we have achieved. So who am I? So my day job is actually a scientist. I'm a scientist in Trinity College, and I work in the area of gynecological cancer. So what we do is we try and find new markers to help diagnose cancers early, but we also try to understand how cancer cells can spread around the body. So I also volunteer with an ovarian cancer charity called GYNOCARE. So this is a support charity for patients that are diagnosed with ovarian cancer. We provide education on the latest treatments, patient supports, but also we provide an opportunity for the patients to meet fellow patients. So a bit similar, I think, to the lymphedema group that you have here in Bulgaria. It's an opportunity for patients to meet each other. And for many patients, it's the first time that they will have met another patient. So to be able to talk and share your story brings huge benefits to patients. So I suppose my work with GYNOCARE has really helped to inform a lot of the patient work that I do. And listening to the stories from patients and their experience of the health system has really made me want to try and advocate for patients and improve their experience. So from, I suppose, my experience with GYNOCARE, this led to the co-founding of a group called the Irish Society of Gynaecological Oncology Public and Patient Involvement Group. Now, that's a bit of a mouthful, but it's really, I suppose, bringing the patient voice into research. So, what I'm going to cover today, I'm going to tell you about our experience and from when we started within that ISGO PPI, I'm going to call it, just to keep things short, and how we brought the patient voice into research. I'm going to talk to you about a project on biobanking and how patients helped us with that. I will talk to you about some of the European and global initiatives that we've become involved in. And then I will finish and let you know a bit about our awareness campaigns that we've been involved in Ireland. So first, the patient voice in research. So this comes under the umbrella of the Irish Society for Gynaecological Oncology. And this was re-established in Ireland in 2015. It's an all-Ireland venture, so north and south, because Ireland is split into north and south, and it covers all gynecological cancers. The members of this society are doctors, nurses, scientists, trainees, allied health professionals, but now patients are also a part of this society as well. So when the society, I suppose, re-established, they looked at the aims and what would be, what did the society want to achieve? And really, it was to improve clinical outcomes for women, to educate, and that was educate patients and educate trainees, to support and promote training in gynecological oncology in Ireland, but to embed the patient voice in the management of all aspects of gynecological oncology. Membership of this society is open to all those involved in the science and practice of gynecological oncology, including patient advocates. So within the society, we wanted to create a public and patient involvement group. And I suppose the term public and patient involvement, what does it mean? And it's become quite popular in Ireland at the moment, and that's really driven by the funding agencies, because they are insisting that PPI is included in all of our grants that we apply for. So it has really been driven by that. And, so it's made people, I suppose, say, okay, we need to work with patients, but where do you start? And what do you do? So, and what does public and patient involvement mean? So the UK have been leaders in this for many years before other countries started. And the UK involved definition of PPI is research carried out with or by members of the public rather than to, about, or for them. So there is a saying, and we use it in Ireland, nothing about me without me. So that's really what PPI. So when we talk about public, what do we mean? It means patients, it means potential patients, it means their partners or significant others, and people who use the health service, as well as people from organisations that represent people who use these services. So our PPI was open to anyone affected by a gynecological cancer: partners, adult children, women with a hereditary risk of gynecological cancer, or anyone with an interest in this area. And my colleague who co-founded the group with me, Yvonne O'Mara, she's a social worker and a psychotherapist. And really, that expertise really benefited our group moving forward, because she was able to moderate a lot of the workshops that we held. And just having that experience in that space really helped our group to move forward. So our goal, I suppose, was to achieve a partnership. When we set up this group, we wanted to achieve a partnership between the patients and the public and our society, the Irish Society for Gynaecological Oncology. And this partnership would promote the quantity and quality of health research, but ultimately it would improve health services, outcomes, and most of all, the patient experience. But what would a true partnership look like? And when we were, I suppose, deciding on setting up this group, we were saying we wanted to set up a partnership, but then we asked ourselves, well, what does that look like? And what would patients think a partnership would look like? So that became the focus of our very first workshop. We asked the patients, if you were to achieve a partnership with the society, what would you think that would look like? So rather than telling them we're creating this partnership, we got their opinion on what a partnership would look like. So our first workshop was held in December 2016. And we invited patients and healthcare professionals. And I suppose, like Mariella is doing today, you're trying to set up and invite patients in. Now, I have to say our network and my network from the Ovacare charity really benefited and got, we had a network already of patients, and a lot of them were quite vocal and wanted to be involved. So that really helped to kickstart our public and patient involvement group. And we also put out messages to all our cancer support centres around the country, telling them this was a workshop. If for anyone with an interest in gynecological cancers, you're invited to come and see if you want to be part of this group. So we had a very good attendance on the day of our first workshop. And we asked, I suppose we asked a lot of questions, but the theme was really, what do you think a partnership would look like? And how would it work going forward? And what would make it a success? So many words, I suppose, came up, and they're displayed in this word cloud. But really, we wanted to be meeting the needs of the patients while improving knowledge and outcome. The partnership would need to be embedded in trust. So words like communication, respect, these were all words that the patients, felt were really important. But communication was a big theme on the day. We also had, as part of the meeting, we enlisted the help of a patient who was an artist, and she did a lot of workshop on visual arts. So when, I suppose to get everyone talking and started at the beginning, we had this workshop, and she asked the patients and the public who attended, to stitch a word that came to mind when they thought about a partnership between patients and doctors. So, many words came out, good and bad. There was a lot of listen, doctors, please listen. Some patients listed, but there was a lot of, positivity, hope, and I suppose hope that a group like this would impact on outcomes going forward. So we displayed some of the little art pieces. Some of the patients chose to bring theirs home as a little reminder of the workshop, but this has now become our cover of our annual newsletter, the pieces of art that were done on the day. So it just brings us back, I suppose, to that very first workshop, and we think about it on an annual basis of how how art can also come into the whole patient-doctor relationship, and so I think it's. it helped also for people to talk to each other on the day and get talking as they were stitching, because some people had never stitched before. This is just some comments from the day, and we got comments like, scientists don't think about the person. We got comments like, feedback and follow-up is really important. Communication was really important. One comment I like was, we're all in the same boat. We are pulling together, you know. So it just shows that we need to work together. So I suppose from that first workshop, I said, and this really defined the work of our PPI group for that following year and beyond. Communication between patients and doctors was a really strong theme, and in particular, body language. And we looked at some surveys that have been done in Ireland, and they didn't really include body language, but that was a big theme, you know, when we were analysing all our little post-its from the workshop. And to address this, we carried out a survey, and I'll talk about that in a minute. The PPI group also identified that education around the research pathway would be beneficial for them, and understanding the process of going from research to a new treatment. So you'll often hear in Ireland there's great groundbreaking research and they've discovered a new marker, but just that realization of how long it takes that to get into the clinic, and that needed to be, I suppose, communicated to patients, because there wasn't an understanding of the length of time and the level of legal issues and everything that had to be gone through to bring something to a new treatment. So to address this issue, we held another workshop, and we've invited in a speaker who had that experience of bringing a research finding to the clinic. We also wanted to develop a terms of reference for our group, to detail what the group would be about, you know, what the governance of the group, how often we would meet. And rather than handing patients a terms of reference, we decided to co-create this. So we had another workshop, and we discussed all the themes that might be part of a terms of reference, and we got their opinion on when they would like to meet. Would it be evening? Would it be online? Would it be in person? So that this group could be successful going forward, because we had co-created this with our patients. So I mentioned about the survey. So we did the survey and we published our findings. Now it was a small survey, but we designed the survey with the patient groups. They decided the wording of the questions, because if you look at some of the validated questionnaires, the wording can be sometimes hard to understand. So we sat and we discussed the language together, and in particular we addressed the body language. Now we did have the help of a junior doctor who went to the outpatient clinics to carry out the survey, because we couldn't have our patient groups going in to the clinics to do that. Ethically, maybe the ethics would allow it nowadays, but that many years ago, it wouldn't have been the thing. So we had a junior doctor who went to the clinics and carried out the survey. And our survey actually found that communication was quite good, that people were happy between the level of communication. But it did raise other issues, and issues like follow-up, contact details, information that the patients, they didn't know who to contact when they left after their appointment. And so this really kind of directed us to address other issues with the patients. So this is an image, I suppose, detailing PPI and the various levels of involvement, and how you can be down at that bottom of the triangle where you don't engage with patients. You can be a little bit up where you're informing patients, but you're not really involving them. You can consult patients, and a lot of PPI people would just give a leaflet to patients and ask for their opinion on the language, and that's not really true PPI. It's not a partnership. You can involve them. They can have, I suppose, defined roles in decision making. But a partnership is really where there's joint decision making, and you have research being initiated and led by your PPI group. And this is what what was happening with our group, with the survey. We were listening to them. We decided with the patients we were going to design that survey, and they were part of that process. Now, we were fortunate to have a very dedicated professor of gynecological oncology, Professor Donald Brennan in Ireland, and he really believed that PPI could impact on patient outcomes. And together with him, we went to our national cancer charity to highlight some of the issues that patients were raising with us. And many of these were actually in the survivorship space. So things like menopause, lymphedema, fertility treatment. So this then led to a national call for a pilot survivorship clinic. And so it was really the voice of the patients that we were listening to that led to this call. And my colleague, Yvonne O'Mara, who set up the PPI group with me, she became a project manager on this program. So she brought all that expertise that she had from the PPI group, but also she involved the PPI group really going forward within this pilot program. And one of the first things that this survivorship study did was they created a personalized platform for patients and their partners impacted by gynecological cancer. So I said to you, one of the things that came up in the survey was people didn't know how to contact someone after they got their diagnosis. They knew they had a cancer. They often didn't know the detail of it. They didn't know where to go for further information. So what this project did was it created a diagnosis delivery card for patients. It told them who they saw on the day. It told them the type of cancer they had. It told them the stage and the grade of cancer. The doctors then told them about this online platform. They register there and they put in that information. So they have it on their card coming from the hospital and they pop it into the online platform, and this will give them the relevant information for them. Now, there's also lots of other articles on this platform, but it just personalizes the treatment for their type and stage and grade of cancer. And this has been really successful, but the PPI group have been integral to this. They have been involved in every step. They have told the people creating the platform the information that they want to know, and it's been updated all the time. But they also, one of the elements in this platform is decoding the science. So some of our trainee doctors will take, say, some of the new publications in gynae cancer, and they will do a lay summary so that the patients know what are the new discoveries, what are the new treatments that are coming in gynecological cancer. Now, this has been populated by a lot of our doctors, allied health around the country, and really having Professor Brennan asking them to help has been a huge success, because if it was Yvonne or I maybe asking, you may not get the engagement, but having a professor that is asking them to help out with this platform. But now people are really seeing the benefit of this, and there are lots of other. The breast cancer are now starting one, and they're using the same model. So it's become very popular now in Ireland, and people are trying to replicate it for other cancer types. So it costs a bit of money to keep this platform updated. There was a lot of background work to do this, but they have been successful in getting funding from pharmaceutical industry, but also Ovacare, the charity I sit on the board, decided they were going to devote some money to this also, because the amount of information that's here for ovarian cancer patients, we could not replicate. So rather than trying to create information themselves, they have fed into this platform. So everyone, it's kind of the go-to stop now for gynae cancer. Also, as part of their diagnosis, patients get an image of the anatomy, and they mark out where their cancer is and give them more information. And this whole project, the diagnosis delivery card and the images are being rolled out by ESGO now, the European Society for Gynaecology. They have chosen it as their project of the year for this year. So I'll talk a little bit more about ESGO in a few minutes. But so this has been really, I suppose, transformative, and because it's been used by patients, and that's because they have populated it. They have been responsible for the information that's up there. Also, within our PPI group, we give an award on an annual basis for PPI. So within the society, we have a Laura Brennan Award. So Laura was a young lady who died from cervical cancer in 2019, but from when she was diagnosed, she advocated for the HPV vaccine. And this award is an important part of the society, and we work closely with Laura's family, who continue her legacy and have been successful in getting a catch-up program rolled out in Ireland for those who missed the vaccine or who changed their mind and decided that they want to get it now. And here we see the Laura Brennan Award recipients, and they all work with us and Laura's family to advocate in the area of HPV. And Laura herself was, she missed out on getting the vaccine because of the age she was before the program was rolled out in Ireland. And I'm going to show you a little video next, one of the many videos that Laura made, because she worked closely with the World Health Organization, and her voice was so strong that they brought her all over the world speaking out on the HPV vaccine. And like in Ireland in 2016, 2017, we had a big drop in vaccine uptake rates. It had been up at 87% and it dropped to 50%. And this was because of online scaremongering about the vaccine. So the health service and all of the charities involved in HPV came together and created an alliance. But Laura has been single-handedly, really the getting the vaccine rates back up was down to her voice, because she spoke out so strong. So I'm just going to show you one of the videos that she made during her advocacy campaign. Let's play. Yeah.
Hi, I'm Laura. It's 12 months since my HPV vaccine video was first launched, and I can't believe how far we've come. I've just learned the amazing news that the uptake rates for the HPV vaccine is now 70%. That's 7 in 10 of this year's first-year girls that have received the first dose of the HPV vaccine, and they're now due the next dose this term. When I found out that my cancer was terminal, I wanted to use my voice for good. And for the last 12 months, I haven't shut up. From the Late Late Show to Clare FM, from Copenhagen to Dublin, every time I tell my story, my hope is that it will save a life and save someone else's family from going through what my family are going through. And I'm thrilled that people are listening to the reality of a life with cervical cancer is really like, and finding out themselves that the vaccine is safe and effective. And along with cervical screening, it's the best tool that we have to help us move forward towards eradicating cervical cancer. 7 out of 10 is great, but like I've always said, I won't rest until as many of our young people as possible are vaccinated. So let's keep the change going, one vaccine at a time. Thank you for listening. Remember to get the facts and get the vaccine. Protect your future.
So a very powerful voice. And, the catch-up program in Ireland now is called the Laura Brennan Catch-up Program. So really dedicating to the advocacy of Laura and her family, who are still working hard. They always find something to work on. But, so it is a great legacy. So I suppose when we look at our PPI group, what has been the key to the success of the PPI group? We have some fantastic patients who were always willing to speak up to make change, willing to get involved in research, willing to share their story to make a difference. Having dedicated doctors who are willing to work with patients and form those partnerships. Patients now attend any of the medical meetings that the society holds, and we have dedicated patient sessions. And as I said, we were also fortunate to have a real leader, Professor Donald Brennan, who supported everything we were doing, and he was able to bring his colleagues along the way. Some of the smaller, I suppose, more practical things was having an annual newsletter so we could show patients and stakeholders what we were doing. But if someone was interested in joining our group, then we were able to say, well, look, this is what we've done. If you're interested in joining, we'd love to add you to our mailing list. Having a website was also important where we have those newsletters. But one of the other things that we're finding really successful at the moment is some of our doctors are putting at the end of their letter that goes to the patient, telling them about the PPI group and what the PPI group is doing, and if they'd like to hear more, please contact Sharon and Yvonne. So that has been really effective. We get 1 or 2 emails every week saying, my doctor has told me I might find this group useful, and we take it from there. We give them our newsletter, show them what we've done, give them our terms of reference, and then they can decide if they want it to be added to the mailing list. So that's the PPI group. I'm now going to move on and talk a little bit about biobanking and how patients helped us in biobanking. And I'm delighted that I don't have to, the next part doesn't have to be translated, because Mariella has already organized, we had a little biobanking video that was created in Ireland with the public, but with, in particular, high school children, to explain the process of biobanking and research. And they developed a storyboard around the biobanking. And Mariella was really interested in this and asked if we could translate it into Bulgarian. So I'm delighted to be able to show that now to you. Let's see. Is the sound?
Чрез нея се извършват научни изследвания, свързани с рака и други заболявания. Ако ни посетите, може да бъдете помолени да дарите проби за научни изследвания. Какво се случва, ако кажете да? Ще се срещнете с наш координатор, който ще ви обясни всичко и ще поиска съгласие да получи достъп до ваши проби и клинични данни. Вие ще подпишете информирано съгласие. Вашите проби могат да се използват веднага или ще бъдат съхранени в нашата биобанка за бъдещи изследвания. Вашите лични данни са предпазени от закона. Учените виждат само тези данни, които са им нужни за техните научни изследвания. Защо е добре да участвате? За да ни помогнете да изследваме и създадем нови и по-добри лекарства, да разберем рака по-добре. Изследванията могат да отнемат много време. И ние имаме нужда от много хора, за да направим големи открития. Вашето участие днес ще помогне на бъдещи пациенти с рак. Какво се случва с пробите? Можем да изследваме много различни неща от съвсем малки капки кръв или парченца тъкан. Например, можем да тестваме нови лекарства. Да изследваме как ракът се развива и прогресира от увредени клетки, както е, например, при преканцерозата на маточната шийка. Виждаме как имунните клетки действат върху раковите. Виждаме какво правят различните гени при раковите заболявания. Изследваме как затлъстяването е свързано с рака. Тези изследвания ни помагат да отговорим на въпроси като защо някои хора се повлияват добре от химиотерапия, а други не. Как може да направим терапиите да работят за повече хора? Как може да помогнем на имунната система да атакува рака? Всичко това е възможно заради хората, които даряват проби.
So it's great to see that now in Bulgarian, and hopefully it will promote the biobanking for the group here. So I suppose biobanks ran into a lot of issues when GDPR was introduced, and Ireland adopted a very strict interpretation of GDPR, which meant that many samples already in biobanks were at risk of not being able to be kept for research. A committee was formed called the Health Research Consent Declaration Committee, who reviewed consent forms that have been used for biobanks. But it was important now to have a consent form that would satisfy the regulations going forward. But these became very legal documents and really long documents, so which were impossible for patients to read, and they didn't want to read those. So we had a workshop with patients where we tried tried to develop a form that would be suitable for them, but that would also satisfy the legal requirements. And that's just one of the workshops that we held. But having infographics like this to explain the biobanking process to people who had literacy problems was also important. We also created a leaflet that could be left in the hospital outpatient clinics, so to tell them about the biobanking before they were asked to give a sample for biobanking. Our education around the biobanking won us an Irish Healthcare Award in 2021, which was really good. And that's one thing I would say as well is, you know, you should enter for various awards that are applicable or that might be available because, you know, with the patient work, because it's another way of promoting your group and telling more people about you as well. So that's important. I'm going to move on now to talk about a number of, I suppose, European and global organizations that we're members of, and I would encourage you to find relevant ones for you also. For example, the European Society of Gynaecological Oncology have a network of advocacy groups, so this is called the Engage Group, and they hold an annual meeting over 3 days, which you can apply for a grant to attend. And this has been really beneficial for us, but for other countries also, they offer translation of leaflets and many grants to support projects. So it can be anything related to gynecological cancer, and breast cancer is also part of that ESGO Engage group. The Cancer Patients Europe group is another one, and the World Ovarian Cancer Coalition. So being part of these groups offers a lot of resources, so I would really encourage this. Next, I want to talk to you about our awareness campaigns. So as well as involving patients in research, we also get them involved in raising awareness. And this is a lot easier because they're usually very passionate about raising awareness of a disease that has impacted them. So within Ireland, we have created a network of charities, advocacy groups, and cancer support groups, all who work together to raise awareness of gynecological cancers. And we call this the Irish Network for Gynaecological Oncology. And we have over 30 groups in our network, and we all share the same messages on the awareness days. So for example, World Ovarian Cancer Day takes place on the 8th of May, and we use this as an opportunity to promote the symptoms using the BEAT acronym, which stands for bloating, eating difficulties, abdominal pain, toilet changes. So this message is getting out across Ireland that these are the symptoms to look out for ovarian cancer. Last year, the campaign had a reach of over 8 million people. This was the first time that we had raised some money and hired a public relations company to help us get our message out there, and it really worked well. So we had this BEAT campaign going out to media, social media influencers. We had articles in the national news picked up our story, so it was really successful. As part of our campaign also, we get buildings across the country to light up in teal. So teal is the colour for ovarian cancer. And I just have a short video here of some of our buildings from this year that lit up. Yep, you can see them there. So again, if there's popular buildings around the country that could light up, it's not a huge cost. Sometimes it's just a case of getting a sheet, the coloured sheets to put over the lights that they do have. So, but it can be quite effective, and it's quite nice for social media also. So, as I mentioned, we're part of the European Society for Gynaecological Oncology Patient Advocacy Network, and they also have an awareness day on September the 20th. So it's World Go Day, or World Gynae Oncology Day. and raising awareness of the symptoms of all the gynecological cancers. So we have this little infographic that highlights the symptoms of the 5 gynecological cancers. Last year, we ran a Dip or Dance campaign to highlight uterine cancer and how we could reduce the risk by being active. So women swam and danced across Ireland, and the campaign had a reach of over 4.5 million. And again, buildings lit up in purple to mark that day. Our campaigns have received awards over the last 3 years, and the most recent one was just last week, where we won the Best Healthcare Campaign for the PR Awards in Ireland. So we were delighted with that to get the recognition. So what are the benefits of engaging with patients? Well, you have patient empowerment. We hope we're carrying out meaningful research that reflects the lived experience of the patient. We hope it will lead to increase in recruitment either in clinical trials or in other research studies. We have partnerships now that are built on trust. And also we have the awareness and the power of the patient's story. The power of a patient telling their story and their experience is not to be underestimated. So finally, I just want to thank the amazing patients who want to make a difference and improve outcomes for others. Our dedicated health professionals who give their time to talk to the media, to talk to patients at events. And I just want to thank the Cost Action for facilitating this workshop, and to Mariella, Angel and Jean for all the organisations. So thank you.